Good.
Okay, we're back. This is Senate Health and Welfare Committee meeting, and we're continuing. And Jen Carby, you've put together a little table for us that we can look at. Maybe you could just talk it through with us a little bit.
Sure.
And I will say that some of the information that's here is information that I've worked on with Jen and others have talked with Jen about. It's not an end point, it's a discussion point. So let's.
Yes. Jennifer Carby, Legislative Counsel for the record. So I did put potential proposal at the top, so it was clear this is not a done deal. So this is just taking the numbers, they're the section numbers from H 703 as passed by the House, and then looking at some ideas that the chair is putting forward for a proposal from this committee, so changes or in some cases. So the first one, section 20, is the grants to emergency grants to support nurse faculty. And as passed by the House, that's $3 million in ARPA funds to the health department to be distributed over 3 years to increase the compensation for nursing school faculty and staff. This would propose instead doing $1 million to be distributed over 2 years, and then that's 1.5 million. And then just showing you that 1.5 million would go to some forgivable loans for master's mental health that we'll look at down below, and 500, the other 500,000 for the nurse faculty loan forgiveness and loan repayment. And that was just with those two programs, one being a VSAC administered program and the other APEC. Do you want me to just go through, or do you want to stop and discuss?
Let's go through.
I'm confused as to what money's.
Okay.
So I'm trying, so in 1 million, 1 million instead of 3, and then the parentheses is where the rest of the money goes. It should say 1.5 million, but once, so the other, so of the 2 million that would come out, 1.5 million would go toward a new section on master's level remote mental health professional programs at state colleges, and 500,000 would be added to the nurse faculty loan repayment, so forgivable loan and loan repayment program in sections 28 and 29.
Okay.
So I was just trying to help you follow the money a little bit.
All right. The House was doing just $3 million in grant and just
For the current teaching faculty,
giving them a bonus.
giving them a bonus.
Right, so there's $1 million to be distributed over 3 years, $1 million a year for 3 years.
Okay. Well, how many faculty do we have? I mean, what is this? If this is $10, who cares? If it's
Don't think I have,
several $1,000s, that's, people are likely.
I think in an earlier version, it was specified that it was, I think, I don't want to get it wrong. I want to say it was 10,000 a year, 10,000 per provider or per faculty member. per
What we've
year.
heard is that there are currently 6, if you
There were
provided
90 faculty.
And we're going to give them each $10,000 for 3 years, and then we're not.
that's what will happen. That's why
That's,
I'm concerned about this as an
Yeah.
incentive to keep people in place.
yeah, but I get 10,000 a year, and then I have this huge cliff. And
Okay.
I mean, I've unless I'm really good and really frugal and put it in my IRA or something, which would be wise,
That would be the smart thing.
that would be the smart thing. But if I've bought a house or a car, I'm going,
So
not
you're,
my lifestyle.
so the question is the value, the return on this investment, and will it keep nursing teaching professionals in place
Has anyone asked that?
after the incentive goes away? And then what requirement would we put on it? So let's go through, let's ask all the questions we need to ask,
Yeah.
and then, we'll just.
That's just a huge amount. It seems like we might give the money to whoever's running the nursing schools and say, up their salaries. And just,
Well, and I think it did get, so in the actual bill language, it provides, has Department of Health distributing the funds, lump sums to the nursing schools equitably based on their, their proportion of the nursing faculty and staff, but it does not specify.
I think the
how they
idea
are
is,
enhancing salaries, I would say.
Yes, it is to increase compensation, but it doesn't tell them.
yeah, and part of it is it's ARPA, so we can't put it in their base salaries. We have to spend it in 3 years. So I think that the idea was get through 3 years by giving them incentives so they'll stay.
Stay for 3 more
And then
years.
these other
And then they
programs
leave.
will hopefully build more and train more nurse faculty so that we
So
don't
when
have
I'm
much of a
looking on,
shortage.
do I want to move here? What salary, I mean,
This is for current,
Yeah.
These are the people who are currently here
Yeah.
teaching. There's another section.
where we're going
Where we're
to send people with
Yeah.
things like forgivable loans.
And that's where I think some of that money, that we took from there
Okay.
goes $500,000. So, taking 1.5 for mental health, the programs we talked about earlier. And then 500,000 would go to nurse faculty loan repayment. And then, there's $1 million left there for this incentive.
Okay, so $1 million, yeah, you could probably do an incentive payment. But what I've heard is that the problem is that the teachers are getting paid less than the nurses who are out.
And which is why
And so
we,
you can't afford to do it. That's the problem we need to solve is you need
increasing their salary.
increasing their salaries.
And I think that this was a temporary attempt to do that, and that's probably why the House put a large number in there, because they
Yeah,
wanted it to be.
That's just a huge.
I mean, in terms of the cliff, that I think that people, there are bonus programs all the time as an incentive to keep people, and
Right.
people have to do their own sort of planning, and sometimes they'll say, I'll stay for 3 years, or sometimes they'll say, oh, I can pay off my car loan with this,
Yeah.
and we'll.
Usually we've been looking at $1,000. It's been the rounded figure, 1,000, 2,000.
So here's what I'm gonna suggest, because I just wanna look at 287 with us today.
Yeah,
If we could go through the table,
Okay.
I know there's huge questions, I understand that, especially on this one. This one's got issues.
I mean, I can't believe the House didn't talk to DSAC and AHAC before
Hello,
giving them jobs.
hello.
I think they did, they just may not have fully.
They were pretty
Let's go
clear.
on to look at the table, and we'll go right to section 21. Jen, just walk us through how the money is being moved now, and then we will have to come back to this sometime.
Okay, so section 21 is the nurse preceptor grants. These are the incentive grants. We go to AHS to provide incentive grants to hospital employed nurses to serve as preceptors to nursing students. The bill from the House is 2.4 million in general fund, and the proposal on the table would be 1.9 million in general fund, and take that additional 500,000 to and put it into that master's mental health program that we'll see at the end. So we get to $2 million for the master's mental health, and that comes from sections 20 and 21. Section 22 is the healthcare employer nursing pipeline and apprenticeship program. The House bill appropriated 3 million in ARPA funds to VSAC. And the proposal on the table would be 2.5 million, not clear to whom. Didn't sound like VSAC felt they had the expertise for that. And moving the remaining 500,000 to another program.
So we heard that that would be best.
Yeah, did AHAC say anything about it? Yeah, we should have asked her.
I think they agreed with.
I don't know,
But I don't think
there's
they
anything else.
Positively said we should do it.
No, I
Yeah.
don't, right, that one was not as clearly in either of
Okay.
the wheelhouses, although it does occur, there are some that are happening now. I'm trying to remember, there was money appropriated in last year's budget, I think, or maybe, but last year's budget adjustment, to create some of these, and I don't remember who it was appropriated to, but I bet we could figure it out.
Okay, we'll figure that one out.
Just-
But it could be
wasn't
AHEC or
clear
it could
that
be
it was
something else.
ESAC.
Right.
Yeah,
Sections 23 through 25 are the nursing forgivable loan program. This is codifying the existing program that Marilyn Cargill said VSAC has been doing some version of for a number of years. This is the $100,000 kind of placeholder to keep it keep it funded in the budget. And the proposal is not to make any changes to that. Sections 26 and 27 are the nursing and physician assistant loan repayment program. And the House version has $2 million in ARPA funds going to the health department and VSAC. And this is one that sounded like there was consensus among both VSAC and AHEC that this was more appropriately in AHEC's wheelhouse. And the proposal would be 2.5 million here, with that extra 500,000 coming from the pipeline and apprenticeship program. And the chair was thinking of perhaps adding other professions in here as well.
So if we added other professions, we may, looking back at section 22, we might want to just put that at $2 million and add another million in with the other professions. That might make way more sense.
to make this
There's a
3
list.
million,
Making the,
20,
Yeah.
section 26 and
Do you want
27.
to change that?
Yeah.
Can we add, I mean, I think that it sounds like APEC already has in place the
framework.
framework,
Yeah.
thank you, that's the word I was looking for, to do a bunch of these loan repayment programs for a bunch of, can we just make it broader so that,
Yes, yeah.
you know, they said medical techs, a dental hygienist, general surgeons, primary care physicians, you know, just making it broader and then having them prioritize.
We want to be careful about how much support staff we're putting in place. You know, some of it might be the receptionist, and I don't know how that,
Right, I also think you would need to give them criteria for how they determine the
Okay,
prioritization.
they have to, yeah.
Um,
So this is a good idea. So we could list including,
yeah,
and then list the professions that we want to see added, and then leave it.
yeah, because I mean, I think it's a good, she was making the point about general surgeons, and there is money apparently in the budget for scholarships for primary care physicians, but not loan repayment. And
This
so
is
just
where-
adding them to the pot and then would be helpful.
So maybe even something like AHEC to prioritize based on workforce shortage needs or.
Yeah.
workforce shortage
Included,
areas.
so we want to have them think, yeah. Okay.
Yeah, I agree, and then. Yeah,
This is good.
Okay.
Okay.
So you want to say add other, expand. Other
I'm
professions.
starting to feel better.
yeah, breathe now.
So you wanted to include specifically mention dental hygienists.
Yes, please. Yeah.
I think, is medical technicians, is that the right word? I don't know.
You could have lab technicians.
Because there is a huge shortage of med tech.
Med techs.
Technicians.
She didn't have her finger on that pulse. so-
Med techs too.
Yeah.
Medical
but different
general, you want to put general surgeons in here as well? Or you just let her?
I think let the decision making happen. I think some of the lower level support staff is probably
Okay, all
what we heard as being important.
And
right, so I will say including dental hygienists and medical technicians.
not, I think we should add physicians, primary care physicians and general surgeons.
They already do
They're already,
primary
yeah, there's a
care,
separate.
and they're doing child psychiatry.
Although it's not low, well, they do actually do a physician loan repayment.
But doesn't it have money in it?
So let's put primary care and child psychiatrists, because those are like
Yeah,
scarce.
and if we give them a list and then just maybe criteria for prioritizing, they might not do any surgeons, that's fine, but there might not be one to do, but.
Yeah, there might not, that
So
would.
dental hygienists, medical technicians, primary care providers,
child
child
psychiatrist,
psychiatrists.
general surgeon.
Yeah, I don't think we want to micromanage.
No, I don't, I don't,
They're gonna go by what comes through the door.
Yeah,
yeah,
And nobody controls that.
right, the need in the state, and,
Yeah.
yeah,
Right.
and the
So
application.
anything
Based on
we need,
workforce.
that's the
Based
way
on
the
work-
door
based on
gives.
workforce
Yeah.
shortage areas.
I mean, I've sat on
Which
that
is something
board.
that I know from having seen Liz testify in other settings, they are tracking all the
they're
time.
on top of it.
Yeah,
More than we
I
are.
just to let you know, I did work on the, I was on the board, but I also worked for the loan repayment program. They have a very, very solid system for decision making.
Yeah,
Okay, two
Okay.
more, sections 28 and 29 are the nurse faculty forgivable loan and loan repayment program. The House version had 500,000 in ARPA funds to the health department and VSAC. And based on the recommendations, this would split that into 500,000 to VSAC for loan forgiveness and 500,000 to AHEC for loan repayment. And it takes that other 500,000 from the grants to nurse faculty in section 20.
We can think about that.
And then finally, a new section, potentially providing $2 million to VSAC for loan, what did we decide, loan forgiveness? Or forgivable loans to master's level remote mental health professional programs at the Vermont State Colleges.
so I would say, let's not limit it to remote, because there are.
It was, let's say including remote. That's it.
You can
Yeah.
say including remote,
Yeah.
but there are in-person programs, and I would
Yeah.
just, I really think we should not just say mental health. I want to make sure it includes social work, because social workers are often.
I said mental health
Master's
professional, I
level.
said master's level mental health professional programs. So
Right.
that includes social.
Social work?
Yes, that includes social.
Okay,
And there are, yes, there are a number of different a number of different license types that come
under that
come
umbrella.
under come under mental health professional.
Okay, here's what I'm gonna suggest. I'm gonna suggest that we just we wrap our arms around this right now.
I will
Yeah.
send an updated version to
Yeah.
Erin to read those.
And then, I'll keep working with Jen. And, we'll try to get to some closure on this. I've asked, Economic Development wanted me to go in tomorrow morning at 8:30, but I have a meeting from 8 to 9, and I told them that I could be in later in the day on tomorrow, preferentially on Friday. That would give us time to fine tune what we've recommended. Anyway, that's where we are. So let's move on for just a few minutes, Jen, on 287, if we can. Where are we with this bill?
S-287 is
Just
the.
remind us what's here, and then we're gonna take a break. We got testimony coming in tomorrow.
Kumbaya, right?
Huh?
Yes.
Yeah.
Briefly.
Briefly.
This is the one that you
What is
heard.
it? What did you say?
I said this is one, everybody with the hospitals and the health,
Oh, yeah, they're on
they're
there.
all singing Kumbaya.
Yes.
supposed
to.
This is the.
I have been hearing from Agency of Human Services that they have recommendations they would like to make when they're coming in tomorrow.
On 287?
Yes.
Okay.
Yeah. Oh, gosh. All you
well,
do is say Department of Health and there it is.
Those are both.
Right, so I'll let you take over.
Okay, so just briefly, and then we're gonna take a little break.
Yeah, so S-287 is the bill on patient financial assistance policies and medical debt protection. Creating those more standardized patient financial assistance policies at hospitals and ambulatory surgical centers. You have heard from Devin Green and Mike Fisher. It would not, so it would take, if it enacted, it would take effect on July 1st, but it would allow 2 years for the facilities to come into compliance.
The language that the Department of Health is going to be concerned about is on the, are the thresholds, income threshold?
Department of Health or
I'm
AHS?
sorry, AHS, Addie Strumolo.
Yeah, isn't it Diva?
Yes,
Yeah.
it is Diva, that's what I was thinking.
I am not familiar with.
So that
those.
whole section that is underlined on financial assistance policies for large healthcare facilities. So we'll have to listen to what they say and then make a decision, given that we were told that there was a very, that there was a balanced agreement on that. So we're gonna have to listen with the balanced agreement maximized.
Which, could you just tell me which
Yes,
section
I
that
will.
is?
It is section,
Financial assistance.
it is the section 9482, page 5. Yes,
Okay,
there it is. So there's some numbers in there, and Diva would like to come in and speak to that, and they're coming in tomorrow on that.
Do you have something in writing from them I can look at in advance, or I can reach out to them?
Sure, yeah, I think they might have sent, did Addie Stromo send you anything here? No, not yet. Can you reach out to her and ask her to send her comments to Jen Carvey?
Yes.
Okay, so we're gonna take a quick break.
they're worried it's gonna disincentivize giving health insurance on the exchange.
Questions?
Or signing up for Medicaid, you know, that.
Senator, questions? Any
No,
questions?
I'm fine, I
We
was
wanna
just
get
on
to
Jen.
closure here, okay. So let's take a break until 10:30, we'll come back and we'll hear folks on